Hello, everyone. Welcome back to Physio Minds. I'm your host, Alex.
And Theo?
Today, we're going to be talking about some of our didactic, which in short term means our schooling or what we learn in our books before our clinicals. So for our first semester, what we're going to talk about is the classes that we had, how to categorize them into the most
Levels of difficulty.
yeah, levels of difficulty, but also like which ones can you study more for, less, and kind of
Yeah,
finagle it in a sense.
right.
Um, and also like who to study with, how to study them, and then kind of go from there. And before we get there, I want to say, what was the first class we had?
Um, it was PTP, which is physical therapist practice.
Okay, so our first class is physical therapy practice. It's like kind of like the 101 class. It's like basically it's just laws and what to do, what not to do.
Regulations.
Exactly.
How to not be an asshole, basically.
Or show up on time for
Right.
class. So, so before we even the first day of school, I knew one person there, and well, yeah, I knew one person for sure going to school, and I had no idea if Theo got into the program yet. We're kind of just like, what do we
Yeah,
do?
because you also don't want to ask, hey, did you get in? Because it's disappointing you don't get in, So
Right.
I didn't want to text you, be like, yo, I got in. Like, did you get
Yeah.
in? So it's kind of like, all right, let's wait and see what happens.
Let's wait and see what happens. And so I'm sitting in class, I'm in PTP1, professor's talking, and it's like, again, it started at like 8 o'clock, I want to say. So it's like 8:02, 8:03. She knows people are gonna straggle in. And here comes Theo opening the door. And I'm like, oh my God, this kid's in this class too. I'm like, so he did get accepted. And he kind of just gave me the eye. We're like, yeah, we know what's up. So he sat next to me and we just started talking since then. And that's kind of like we built our
Yeah.
relationship from there.
Yeah, so if you didn't pick up on it, being late is a little bit of a trend in Miami. I think I've gotten better, especially like with my professional stuff, being on time and stuff, because that's important. But yeah, Miami traffic is tough, man. Getting from Kendall to Coral Gables was been like 45 minutes. That day might have been like 60. I tried to be early, you know. 3 minutes late is not bad.
3 minutes late is actually pretty on time for you.
And first day, you don't really know where you're going. So it wasn't
Didn't
too
want to
bad.
get there early or anything. God forbid you woke up 10 minutes earlier. Anyways, so yeah, so our first semester we had, which was our physical therapy practice one. We had soft tissue massage one, we had applied anatomy one, gross anatomy one, pathophysiology.
Yep.
We had something else, right?
Yeah, PCM.
Oh yeah, that's right, PCM, practice patient care
No,
management.
patient care management. Yep.
Patient care management. That class, that class did me dirty.
Yep.
um,
That it did.
all good times though, all good times. So basically, when you're in PT school, I guess like the first few weeks, you're kind of figuring out how to study, and the
Yep.
professors will really, I guess, will scare you into like you live and breathe physical therapy. I don't know if you
I
remember that.
mean, I feel like they weren't wrong though. Like I remember like specifically the first, I think it was first or second day, like we went to gross anatomy, which is basically like anatomy, like right. And I think what we were doing spine. I think did we start with spine?
We started, yeah, with spine. Yep.
Yeah, we started with spine. And I'm here thinking like, okay, like, they're gonna teach you start from like scratch or whatever. First day they brought out all the models and then we started playing with the models, had to like name anatomical landmarks. And there were people in the class like, oh, this is the dens, this is, the a
This is the
facet joint or zygopophyseal or whatever. And I'm like, I don't know any of this. Like I
yeah.
went home, I promise you, like you can ask my mom because I remember I went home and like I locked myself in my room and I spent like it must have been like eight hours like the on that Friday, because we had Fridays off that term. And
Yeah.
that Friday, I spent like 8 hours in my room, like going over anatomy, because I felt like I was behind
Yeah.
first week of school.
I,
Little did I know though, it was kind of like, all right, this is what you're responsible for the first exam, and I was studying like that first week. So um, that's a lesson to like be aware of a little bit about your surroundings and what is actually do, what is not do. You know?
yeah, I think that's the biggest thing is they did it on purpose though. They do it on
Yeah, I think
purpose
so.
because they want you to really think about your profession and what you're doing. Because it's really important to know your landmarks. It's really important to know your
For
nerve
sure.
innervations for your muscles, origin
Yeah.
insertion. That way you kind of know where the muscle goes, what the action will do. But I remember talking to the professor for that class, and it was just like, yeah, we do this on purpose. Because I came up to him after a week and I was like, I have no idea what I'm doing. Like this is
Yeah.
well above and beyond what I learned in undergrad. So don't feel, I mean, you will feel overwhelmed, but try it. Just remember you're not the only person in that boat. I
Yeah.
mean, every person in the class was thinking the same thing you were, is like, what is going on, is basically what we said.
Right.
And
Right.
it was kind of crazy, but
And honestly, it's good to be a little overwhelmed because, and it depends on how you deal with it. But like I know for me, like like if I feel overwhelmed or I feel behind, like I know like I sit down and like I study. You know what I mean?
right.
And honestly, like studying gross, like if there's for me, and maybe you think differently, but for me, the most important class in all of PT school is gross anatomy.
Yeah,
Like I think 75% of what we do is anatomy. Like if you know your anatomy well, like you'll be able to get the patient better. You know
exactly.
what I mean?
Yeah. Yeah, that goes with like gross one and gross two. So like gross
Yeah.
one was more upper extreme, was it upper extremity or more the spine? And then I think it was upper extremity.
It was the spine and upper extremity, and I think gross two
Was like
was like
pelvis.
lower extremity, the organs,
Oh,
and the skull, I
yeah,
think.
yeah, yeah. That's right. Yeah. But yeah, gross was by far, I think, the most difficult class, along with pathophys, but
Yeah, for
it's
sure.
pathophysiology is just a tough class in general. There's
Yeah,
so,
and it's memorization too. It's like,
but it's a
you have
lot,
to understand. Yeah, it is a lot. You have to understand physiology, and then you have to understand like how it can go wrong,
right?
and that's tough, right?
Yeah.
Like, and plus, and I think what makes it tough too is that you're still figuring yourself out, right? Like you're still figuring out how you study, how you learn. You're still figuring out PT school.
Right.
Like you're in a new, for some people, you're in a new city, you're in a new state,
Hmm.
So all that, makes it more difficult. And, it was great having like friends like Alex or whatever, that we could just like we studied together, like we talked through things, we studied together, like for every class, every test, there would be like like FaceTime calls,
Yeah.
like reviews.
Yeah. Do you remember we used to, so I don't know what class it was, but I remember I would send you text messages saying like, oh, what is the innervation of this muscle? And we go back and forth just for shits and giggles, just to be like, yo, stay
Yeah.
on top of your stuff.
Yeah, and there was like other, I think it was that during applied anatomy one, and I think it was like the final.
Hmm.
And I think we were going through like, all right, like what is this muscle? All right, what's this muscle called? What are its attachments? What is the innervation? And it was kind of like you point out a muscle, and then you kind of have to like we don't even ask, you just spit it out. You know what I mean?
Yeah.
Like you got to tell me all the attachment sites, all the innervation, like the innervation, segmental innervation, like not just what the nerve is, but like what brand, like where's it coming out of, right? Like is it
Yeah.
C5 C6, is it C5 C6 C7?
Yeah.
So
And once you went forwards, meaning you went from the spinal cord out to the roots, out to everything
yeah.
else, to the peripherals, basically we'd be like, okay, cool. Now you know it that way. Let's go backwards. And you're just like, what?
Yeah, you gotta. That's how you gotta know it, though. You have to know every like forward, backwards, in and out.
Yeah,
Yeah,
because now when you go to the clinic and they're like, oh, by the way, there's a spinal cord injury at L1. You're like, okay, well, what's that L1? what attacked. Like you have to think of everything below that. If it's a complete spinal cord injury, you're like, okay, what is gone or what is still left over,
Right.
or if it's partial, you're like, okay, what are we working with?
Mhm.
It comes in handy. Definitely does.
Honestly, I think, and we're getting a little off topic. We need
Yeah,
to get back on track. But just last thing, like I think the hardest part now, like once you learn, because learning anatomy is like learning a new language, straight up. Like it's you're talking a different language. Like people do not understand you when you speak. And I think that's one of the difficulties that I've come across, like in clinicals. Like
yeah.
I know my stuff and I'm confident in what I say, but the patients don't understand me sometimes because I'm like, oh, like, you have a nerve entrapment, here, or we need to work on proximal stability for distal mobility. And they're looking at me like, what are you talking about, dude? Like, you know what I mean? So one of my challenges and like something I'm trying to get better, and I'm improving, but like patient-friendly language.
Yeah.
Explain it, like dumb it down like 100%. You know what I mean? Like and I told my CI actually, I told her, I was like, look, like it's crazy because I knew how to explain it. Like I obviously didn't know this 3 years ago, and like I knew the words. Now I have difficulty coming up with like how to explain it in like patient friendly or like layman's language. You know what I mean?
Yeah, exactly. Yeah, that's tough to do. And I just try to listen to my CIs and kind of see what they're doing or what other physical therapists are saying and be like, oh, I could use that. That sounds like a good analogy or something. So let's move away from gross because we could sit here and
Yeah.
talk about gross
All
all
day,
day.
all day.
Um, let's do applied anatomy and soft tissue. I think soft tissue is like the best class. So not it was the best class to have for the end of the week because
Yeah.
you come in, you have your gross whatever Monday with applied anatomy and then PTP or whatever it was, and then the last class of the week was soft tissue massage. And this
Right.
is kind of your class where you really just learn how to put your hands on the patient in like in a skillful way.
Breaking barriers. Yeah, I don't think it was educational. I'm gonna tell you right now, I don't think it's very rare that I use some of those techniques that we learned.
Yeah, me too.
And it was really just to like get you comfortable with one, seeing skin,
Yeah,
right? Asking people to take their clothes off,
right.
putting your hands on someone and understanding like there's like layers, right? There's like depth that you have to like go for different techniques and kind of understanding that. But again, like those techniques, I typically don't use them.
The amount of times you and I goofed off and applied and soft tissue, I'm surprised we didn't
Yeah.
get kicked out.
Like applied, I don't remember. I remember taking applied pretty seriously. Um, but soft tissue, I mean, it was basically massage. Soft tissue one was basically like, can you touch someone, like, and watch where your hands are going so you don't get to any inappropriate areas. And like if you could do that, you pass soft tissue.
Right, right. And a lot of it is you'll realize the first time you put your hands on a patient, because Theo and I were partners. So you're like, oh, okay, I can put my hands on a male, whatever, and go through everything. But what if you switch the roles? What if a
Right.
female therapist is working on you, or what if you're working on a female? So now you have to figure out, what is the proper way to drape them? What is the proper
Mhm.
way to be able to touch them in an appropriate manner?
And your body mechanics too. Like I was actually talking about this the other day. Sometimes like even instructors, like when they're teaching like a mobile or manip, like they put their hands in a position and then they turn away to the class and like their junk is like right in front of the person's face. You know what I mean? Male or female, like no one wants that. You know what I mean? So you just gotta be like always aware, of like where you are, where your body parts are in space, and where the patient is.
Right. And always ask for permission. Always ask
Yep.
for permission.
Always ask for consent.
Always ask for consent. Before you do anything, you walk in the room. Do I have your consent to proceed after you tell them what you're thinking of doing?
And then you lock the table.
And then you lock the table. That's actually really true because there was almost an incident that I heard about where a patient, those massage tables we buy for
Yeah,
school.
yeah,
It's
yeah.
kind of flimsy, and if you sit towards the edge, it'll kind of tip over. So
100% tip over.
yeah. Well, you just have to be careful because a patient can sit at the edge of that and they can tip it over if they put their weight in the right spot. So just be careful of that stuff. Um, yeah, I think the other class that is also pretty big, the first term, is PCM, peer management.
And that's where the lock the table joke comes from, because PCM is uh yeah, it's patient care management. It's a lot of safety stuff. It's how to handle patients safely, how to teach them to walk with crutches, how to go up and down stairs, how to get them transfers from bed to wheelchair to bed.
Mhm.
Um, and it's if you basically don't auto fail, you pass the class. And what I mean by that, there's like the auto fails, you auto fail for safety, and that goes all of PT school.
Yeah,
But especially for PCM, if you don't auto fail, you're on your way.
yeah,
Like you're passing.
yeah.
Um, and what's auto failing? Not locking the bed,
Not locking the bed. Yeah.
not putting on a gate belt,
Mhm.
right?
Letting go of the gate belt,
Letting go of the gate belt 100%.
breaking precautions.
Breaking precautions, post-op patients, and you'll learn about that whatever when you get there. But um,
Yeah.
yeah, so just don't autofill, man. That's it.
Don't do it.
Yeah, just don't do it.
Yeah. And unfortunately, sometimes depending on your proctor, they've gotten better. They've gotten better. Depending on your proctor, one can be more um, strict than others, but
100%.
sometimes when the proctor's writing something, they don't catch everything. So sometimes they'll record you for school, like they'll have like a camera and they'll go back and see what you did, and
Right.
kind of before they autofill you, they really look into it to make sure, like, should I have autofilled him or her, or are they safe enough to take care of a patient and pass them?
And in the end, I think it's like also important to know that, you know, I would rather them be more strict than less strict,
Right,
especially like, we're dealing with like, you know, sick people, people that are in pain. So it's good. We have to be safe, and I like to know that not just me, because I know I'm always going to try and be safe, to the best of my abilities.
right,
And but it's good to know that as a profession, right? Like PTs are going to become like, now we're become a doctor program, so like you want to know that all PTs are going to be safe, right? So they don't make me look bad, you
right,
know.
right.
Um, so I do like that it's a little rigorous, and like they check you, right? They have the camera now. It's like if they didn't catch it, they go back and catch it. You know what I
Yeah,
mean?
yeah, absolutely. Yeah, and I guess let's talk about uh, some tips and tricks either in the clinical setting or in the school setting.
Okay.
So for me, I went to tutoring. Tutoring is open for anybody who wants to come. You don't have to be there if you're getting straight A's or something. But I found it beneficial because a lot of the tutors were older classmates, I guess you can call them, or older. Or,
Like a cohort that's been there longer than us, a little
yeah,
more experience.
basically like the seniors and juniors of the college, of the graduate school. So a lot of them, they've experienced what you're going through. Most of those individuals that are tutors either I mean, most of them pass the class, 100% of them pass the class, but they pass the class with an A or B plus, I believe, and up. And so these individuals are excellent. They're really good at explaining things. And I went to tutoring a lot. And that's something where even if I knew the concepts, I still went to tutoring because I can talk to the upperclassmen. That's the word, upperclassmen.
I like that.
Um, I could talk to the upperclassmen and I could ask them questions that I either wasn't comfortable asking the professor or I had already asked the professor too many times that I still don't understand the concept. And if that's the case, usually I call Theo up and we try to figure it out. But if we didn't figure it out, I go to the tutors and either we would talk about stuff we didn't understand, and if we both didn't understand it after asking the professor, we go to tutors and be like, all right, you need to explain how our arterial flows from the heart to your right arm or something.
Right.
So it's kind of things like that.
Yeah, and it also like people learn differently, people explain things differently. So it's good to like hear it multiple times in many different ways, especially because you might understand it already. And again, it goes back to that patient-friendly language, but
Mhm.
you might not be able to explain it to a patient in terms they can understand. So hearing it in that patient-friendly language or hearing it multiple times from, different ways to say the same thing, it's always helpful. Always.
Right, right, right. And a lot of the times when I mean, so going to tutoring, I think that's really good. That's just my opinion. If you don't
Mhm.
like tutoring, then you could always get a one-on-one thing. I really like what our school does where you can get a mentor as well. So either that person is a semester above you, it could be a few semesters, but they're always very friendly, and they're always, most of them are very friendly and nice, and they'll be like, hey, this is what you need to get in line. Welcome to PT school. This is what you need
Yeah,
to do, and kind of like show you the ropes of what you need to do
yeah,
for throughout the didactic terms and clinical terms. Because for me, it was a big trans. Like you can tell where your undergrad level studies were. You might have studied some nights. You might have been like going out other nights. You might have
completely
slept
different.
off. Yeah, it's completely different. You really have to know your stuff. It's not like, oh, you can half-ass it and know it.
Yeah, I always like, I mean, like I skated by kind of like in undergrad, like, I would study for tests or whatever, and that's it.
Right.
But yeah, PT schools, like I had to study like I was studying every day, right? Off days, on days, didn't make it, like doesn't matter if we were like 8 hours in class, 1 hour class, had off, like we were doing something. Like
Right.
whether, not you're not gonna study every day 8 hours, but you can be doing something every day.
Right. Even if it's like you said, 20, 30 minutes or an hour or something. I don't know if you said that, but even if it's just a little bit, because for me, my attention span after I think an hour and a half, 2 hours just sitting there straight studying the same thing, I kind of need to stand up, walk around, eat something, kind
Right.
of interact with other individuals.
But
And you'll see that. I mean, our school was pretty good at you can talk to anybody. You could ask anybody walking down the hall and you'd be like, hey, are you a PT student? They're like, oh yeah, I'm a PT student too. So you talk, interact with them, and you'd be like, oh, I'm in this class now. Do you have any suggestions or tips, or what do you know about this concept? And then boom, they'll either know it or they don't. But if they do know it, they'll help you out.
right.
Other things is like take advantage of what is it called? Office hours. If you have office, if the professors have office hours or if they have open lab, that's also something good to go to, especially with gross anatomy.
Hmm.
I know a lot of the times we would go in there and we just quiz each other. We
Yeah.
just ask each other, okay, I know these 10 identified structures. Show me these 10 structures. And you go
Right.
through, okay, this is this, this is this.
Yep. And honestly, even like the open, not the open labs, what's it called? Like where they had like the rooms available and they had like someone
So
like
like study
swabbing.
room.
No, not the study rooms. It was the where they had like the treatment tables. So like we basically take advantage, what I'm trying to get at is like take advantage of, the treatment tables that like, move up and down, whatever, they're like adjustable. Because a lot of like RPT education happened like during COVID. So we didn't have a lot of that. Um and it would have been great for like body mechanics, labs in general, right? Like in-person labs, like where the professor can like put his hands or her hands over your hands and be like, okay, like this is what you do, right? Like this is what it looks like, rather
Yeah.
than like seeing it through a camera. So just take advantage of all your resources
Yeah.
for sure.
And honestly, it sounds weird, but put your hands on as many patients as you can,
Right.
even if you don't know what you're supposed to be feeling, because a lot of times we're supposed to be feeling different end feels if it's for joint mobility and stuff, or even if you're palpating a tendon, or if you're palpating bone or a nerve or something like that, you're just get your hands on a patient and feel it, because one day it just might click and you're like, oh wow, so that's what so and so is supposed to feel like.
Right.
Oh, so this is what this is supposed to feel like.
100%. And I think the best example for that is the lumbar spine. So the low back. And I think that's the one area that, because I again, like we're very manual heavy. Like I love doing joint moves. Like I see a lot of benefits to them.
Mhm.
But the low back, man, I'm gonna tell you right now, like for me, like that's the hardest to feel, especially with, when you're working with healthy, like your classmates or like healthy people, like you can, be able to feel the bones, separating and things like that. But a lot of our patients aren't that, a lot of our patients are, overweight. They're, have a lot of soft tissue, to put it nicely, over the spine. So you're trying to feel very subtle motions through like layers of skin,
Right.
you know, and it's tough. And just having that, like a lot of practice, that repetition, eventually you're going to be able to like notice these subtle changes and these subtle, and in motion. So
Right.
just, keep practicing. Even if you don't, like for me, I incorporate it into my exam for like low back patient. I might not get anything useful out of it, right? But it's, again, it's that repetition, right? And eventually I'm going to get something useful out of it, and like I'm going to be able to help my patient. So the 1-2 minutes that it takes to go through like the joint mobility of the spine is definitely worth it.
Yeah, absolutely. Yeah. Theo, you brought up a really good point, which is repetition, repetition, repetition. And
Big
they've
fact.
instilled it into us as I didn't think it was true until we would get together and I would do so many things on Theo when it becomes the joint mode. That sounds wrong. But I would perform a lot of joint mobilizations, soft tissue, whatever like I had to do in order to practice. But then I go, okay, Theo, and I move on to the next person. I would go to Jasmine, or I would go to Courtney, I'd go to Julian. I just go to anybody who I can get my hands on. I go across the room and meet somebody else who I didn't know the first term. Like, hey, let me put my hands on you if you're comfortable with that.
Because everybody's different, everybody's going to be, some people are loosey goosey, some are just stiffer in general, and you always have to like, you want to have an understanding of what is normal, so you can like figure out what is abnormal, right?
Right.
um and I mean, of course, always compare bilaterally. So
Always compare by. Very true. Very true. Do you have any other tips and tricks you want to give them about didactic?
um I mean, just in terms of studying, like I think for us it was like very helpful, like when we're doing review sessions, like for I don't want to say every exam, but like most exams, especially like the bigger exams, gross anatomy, cardiopulm. I don't think we did for cardiopulm, but like neuro, um, ortho classes, things like that. Like we would meet, the day before the exam, and like we'd have like a FaceTime call or whatever, and it was like
Mhm.
me, Alex, Jasmine, Courtney, Julian. They would all like get on the call, and like we just go through questions, right? Like at this point, like everybody studied, you should know things. We go through questions, explain concepts, figure out the gaps in knowledge. And I think one that's helped us succeed individually and as a group, like as a group, we all do well. And I'm confident that we all know, like I'm confident with anyone treating my mother from our group, you know what I mean? Like, and that's kind of how I rate a PT. Like, would I want you to work on my mother?
Right.
Like if my mom has back pain, knee pain, whatever, like am I comfortable with you treating her?
Exactly.
And I can say for like the group that we study with, at least like I am.
Mhm. Yeah, that's very true. That's very, very true. Oh man, I was just talking to a couple PTs and they're like, man, I haven't really done a lot of manual therapy or manipulations in a while. Do you want to go over it? So now what I've been doing is over lunch break. I mean, we have an hour, so I don't need an hour to eat lunch. So I'll eat my lunch maybe 20 minutes, 25. The rest of the time, I'm either looking at old material that we went over, or I just go and I practice now.
Right.
So that's something
Yeah,
that's
I'm constantly reviewing. Like I'm like if I especially if I don't know something, I'm going back and I'm researching. If I'm seeing a patient like a diagnosis I've never seen before, I'm gonna go back and look at it. I'm during our slow hours or whatever, because I don't have a lot of like a long time for lunch.
Mhm.
Sometimes I don't even eat lunch because like I'm busy like I'd rather finish my notes and eat lunch because I don't want to do notes at home, for example. So like when we're slow, like I'll get like a receptionist, at the clinic, or I'll get another PT, or get someone, because I work in a gym actually too. So I'll get like a personal trainer or something. Hey, come here, like let me try this, like this mob on you, or this manip, or just practice makes perfect, you know what I mean? And like you want to be on point with your interventions when you're doing them on a patient.
Exactly. I agree. And then just to kind of wrap this up real quick, as much studying as we did, we also had fun. So you'll find out your group of individuals or the people that you want to hang out the most with are the people that you're going to basically see throughout your 2.5 years or 3 years. And just don't forget, have fun, do what you love what you do, and
Yeah.
enjoy the time, because it flew by. I don't know about you, man. It
Yeah,
flew
no,
by.
it did. And honestly, like I live by the work hard, play hard. Just as hard as I work, I go and like I go out, I play soccer, go to the gym. Like it's for your mental health, really. Like you cannot be studying, and because basically school is like your full-time job when you're in PT school. And it's kind of like we're working like 60 hours a week, 70
Right.
hours a week, studying whatever. Like you need a break, that's not sustainable. So, go to that happy hour, you know what I mean? Gets
Yeah.
like treat yourself with some food, go to the gym, play soccer, whatever it is, do it.
Yeah.
Whatever makes you happy, whatever, listen to music, whatever it is, get it done.
Exactly. What would you say were your top 3 things you would like to do for when you had downtime or to kind of get your mind off of school?
For me, the gym was a must. Like I whatever I was doing that day, like I had, unless I was super tired, I'm going to the gym, and
Yeah.
like I need that for my mental health. So that's a standard. That would be number one for me. Number two, definitely happy hour. Big fan, big fan of happy hour. Cheap drinks, the food cheap.
Yeah.
You know, great company as always.
Oh, plus you meet so many other people that are
Yeah,
not only within your cohort, but you'll meet other people like upperclassmen or underclassmen. You'll kind of
yeah.
meet throughout the
You
happy hour.
meet people like occupational therapists, whatever, as well. Um, yeah, man.
And then one
And
more.
honestly, naps. I'm a big, like you can, I
Yeah.
mean, and you can probably attest to this. Like, I'm always taking a nap. Like every time you would call me, I'm like, yeah, I'm waking up from a nap.
Yeah. I mean,
It
like
was like,
I'd call Theo and I'm like, hey, what are you doing? He's like, oh, I just laid down and took a nap, bro. Give me
yeah,
30 minutes to an hour. I'm like,
yeah.
no, bro.
No, I'm taking naps between classes. I'm taking like, again, we're working full time, but like it was also nice, like doing it like virtual was kind of nice, because like I'm taking a nap from between classes. I take one nap, and then I take a nap at, like around after class, like around 5, I'm taking a nap. And then I start studying again after that. Like at 6 o'clock, I'm studying yeah. So
No,
whatever,
that's
man.
always good. That's always good,
Hey, it
man.
works for me, so I'm gonna keep doing it.
But you can only take naps at work. They should have like
Yeah.
nap pods or something.
I mean, I'm gonna be honest with you. They got pillows. I'm pretty sure they got a. I don't know if they got a blanket, but they got a bed.
I mean, you have sheets. You have
If,
sheets.
what's that?
You have sheets like for your bed or
No,
no?
we don't actually. That was something that was weird. I was like, how do I drape this patient? And they're like, oh, like we have a private treatment room or whatever. I was like, okay, I guess I'll use like pillowcases, like But, that's a story for a different time.
All right. Yeah. All right. So we're going to wrap it up here. This is our second episode of talking about didactic study tips, and just have fun. Have fun in PT school. It goes by fast. Probably
Enjoy
my best 3 years that I've ever had.
You're gonna make great friends, so enjoy it.
Really, you really do. Um, all right. Yeah. So join us for episode 3. Episode 3 will be coming out soon. Episode 3 will be on what topic would you like to discuss, Theo?
Um, I think we should discuss clinicals. I think we talked a little bit about didactics, and of course, if you guys got any other questions about I know we talked a little bit about applying PT school, didactic, so like the educational component of PT school. If you guys got any questions more specific about certain classes, you can shoot us a DM or whatever, and like we'll answer those and maybe talk about them on the podcast. But I think we can start getting into like more clinical stuff next episode.
Awesome. Sounds good. Thank you everyone for joining in. We really appreciate it, and we'll see you next time on Physio Minds. Thank you.
Peace.